So hello everyone, first video on this channel regarding pharmacology, and today we will be dealing with a topic, a rather vast topic I should say, called as general pharmacology. Now broadly speaking, we have numerous terms and terminologies and definitions of various aspects of the terms that we will be employing during the course of studying pharmacology. But for the sake of this topic, let's stick to two broad aspects of general pharmacology. One is called as pharmacokinetic and other is called as pharmacodynamics. Now before going to pharmacokinetics and dynamics, let's just follow this storyline. Let's assume this is a tablet. Now this tablet does not have any line or demarcation, and another tablet we have here with a visible line in the center. This line is called as score line, and this tablet as a whole we call it as scoring tablets. On the one here that doesn't have any score line or so, we call them as unscored tablets. Now tablets could also be shaped in a tube like structure. Now why do we take into consideration the concept of the scoring tablets? Now to make things simple, we can divide the tablet into half, so those adjustments could be done. Next, ease of swallowing. And in some cases, suppose a doctor has prescribed you, let's say, metoprolol, which is a beta blocker, 12.5. So instead of purchasing this metoprolol 12.5, what we can do is we can purchase the 25 milligram tablet formulations and break it into two. This is cost effective. Now let's move further. A person, because of some ailment, let's say he has headache, and the drug that we are going to prescribe to the patient is tablet or syrup based on the age of the patient, paracetamol. Now this paracetamol, the dosing is again according to the age of the particular patient, but let's assume that this is a normal adult patient, 650 milligram. Now this medicine is also similar to something called as tablet crocin 650 milligram, or a tablet having the chemical structure or chemical name of 4-acetaminophen 650 milligram. Now what we observe here is the trend of the change in the active principle or the name of the active principle. So this one is what we know as generic name. The second one, crocin, is of course the brand name. We have certain preferences like crocin, dolo. There are multiple brands. And the last one is the chemical name. So this person, let's say he is Mr. Tom. Mr. Tom came with a complaint of headache, and you as a doctor have prescribed him paracetamol. Now you have also advised him to take it orally. Now let's assume this is Mr. Tom. Here we have the stomach, duodenum, esophagus, and so on and so forth. And let's draw another structure here. This is the liver. Now the tablet that he consumed orally under the influence of the salivary juices and all the various juices, now when it reaches to the stomach, it gets disintegrated into small particles, and the time taken to break this big chunk of tablet into smaller particles, we call it as disintegration time. The same disintegrated particles would get dissolved into the medium of the stomach, and we call it dissolution. Now, this particular drug substances that has been dissolved into the media would be transported into liver. Now please make a note that this transportation into the liver is via something called as portal circulation. We have to go back to anatomy to again reinculcate this terminology known as portal circulation. Now the drug that has reached the the liver via the portal circulation would undergo a metabolism. Anything that goes into the liver has to undergo a metabolism, and we call this metabolism as first pass metabolism. First pass metabolism. Now, where will the first pass metabolism take place? Obviously in the liver. Now while doing so, let's assume that Mr. Tom took 100 milligram of paracetamol. This is a hypothetical scenario. 100 milligram, and 100 milligram went into the liver. Now the amount of drug that came out of the liver and which ultimately reached the heart will not be 100 milligram. That is obvious because it has undergone some sort of metabolism. Now from the heart, this is the heart. From the heart, obviously heart is the pumping chamber or the pump of the body. Now it will distribute this drug that has already undergone first pass metabolism into various body tissues via the blood vessels. So out of the 100 milligram of drug that was taken initially, let's say 70 milligram reach the systemic circulation. This 70 milligram that has reached the systemic circulation is what we call as bioavailability. Okay, so the textbook definition of bioavailability is the fraction of drug that reaches the systemic circulation in the unchanged form. Now, the 70 milligram of drug that is now being distributed via the blood vessels will act on certain receptors in the body. This is the drug and these are the receptors. This activity or this binding of a drug to a receptor will create a change leading to something that we call as pharmacodynamics. Now, pharmacodynamic in short means what the drug does to the body. This itself is another separate topic. Now, after a drug has exerted its effect in the body, it has to be excreted. And to prepare this drug for excretion, we have to make something to something soluble. Now, this something to something soluble is the next important topic.